Hello, my name is Morina Bongo, and this week I'll be attempting to do the simple running suture. I have my equipment here. I have my sample skin, the imitation skin. I have my needle driver. I have my pair of scissors. I have my forceps, and I have my needle and thread. Of course, this would be as if this would be a sterile procedure. This would be a sterile procedure, and I'd have my sterile gloves and my sterile setup, do the hand hygiene and things that follow with protocol. With the simple running suture, it should be a sterile wound, meaning that it should not be a traumatic kind of wound. And then the other thing about this particular suture is they say that it is faster and it actually provides for a better cosmetic look. That's according to our text. So like all sutures, you begin with a simple, like you're going to do a simple interrupted suture. Lift with the forceps, go deep at 90 degrees, at a 90-degree angle, and come out about 0.5 centimeters from the laceration. And like all wounds, you would have a short end and a long end. And of course, you would do that fast tie, do 2 loops. That's the surgeon's knot. And grab the short end, pull it through. Then 1 loop, pull it away. And then sorry. So you start that like you would start a simple interrupted suture, and then for the rest, go back to the side where you began to begin the running suture. Going down is called a bite. Go down at around a 90-degree angle and come out around the same, not around, time to try to go at exactly the same depth as you did. Pull through. You'll have to reset the needle a couple of times. Apparently this suture is used around the scalp a lot of the times, and it's the one most commonly used with episiotomies. Then you would use this suture if it's not a traumatic wound, if it's not gaping, because of if there was an infection, then you would need to remove the whole suture. If you think that there would be an increased risk of an infection, the best suture would be a simple interrupted suture, because that way you would just go ahead and take the sutures away from the area that is infected only. Again. Sorry, I'll have a lot of equipment in the way. Just this tells you that it's practice. Try to do 2 more and then close it. Just to demonstrate what it looks like. Of course, it's not perfect. 1 more. And then I'll close it. As I prepare to close, that short end would be a double loop. So leave about the same length of that double loop. Then do the of that double loop, just do the tie like you would normally, just twice, loop twice, grab that, pull it towards you, and then towards you, away from you, towards you. And 3 knots would be sufficient to make that sturdy. Don't pull too much of the skin, that would just make it a skim neck. Don't pull too tight, don't put a lot of tension. We practiced some earlier, and that is your simple running stitch. Thank you.